So I actually asked to show me the radial tuberosity, dorsal tubercle of the listel, but unfortunately only one of you could answer. Okay, and that answer was also, half of the answer was true and half of the answer was absolutely blank or wrong. Okay, no problem. Somebody is saying that they don't have books, textbook. Somebody is saying that some of you are saying that till now we don't have any bones. But without bones, it is very hard to learn osteology. Okay. So this was radius, and this is ulna. So ulna is the medial mode. এটা তো রাইট সাইডেরটা দিয়ে দিয়েছে, যাই হোক ভালোই হয়েছে, আমার পক্ষে ভালোই হয়েছে। So ulna, this is the ulna, is the medial most bone of the forearm, and this is post axial bone. Okay, this was the pre-axial and this was the post-axial. After rotation, this becomes medial. So this is ulna. So similarly, you know that in long bone it has got upper end, lower end, and intervening shaft or the body. What are the features of the upper end? In the upper end, we can see some projections. One hook-like projection and another bracket-like projection. So this hook-like projection is called Olecranon process, and this bracket-like projection, any projection is called process. This is called Coronoid process, and in wrong, the left sided, whatever might be, forget about the side. So this is the Olecranon process, and this Olecranon process is accommodated within this fossa. This fossa is called Olecranon fossa of the humerus. Clear? Similarly, this, when it is accommodated in full extension of the elbow, not during flexion, only during full flexion, this has been accommodated within the Olecranon fossa. Similarly, we will get a coronoid fossa where we can accommodate this bone, this process, which is called coronoid process. Okay, so this is called the coronoid fossa, we know. So which is been and this coronoid process is been accommodated during full flexion. During full flexion, not during extension, only during flexion. So this coronoid process is been accommodated. And we are getting a smooth area. In a inferior surface of this olecranon, okay, and also over the superior surface of the coronoid process. So this area, that is an articular area, okay, it articulates with or it moves over the trochlear surface, that is a smooth articular surface of the humerus. So this name of this surface should be trochlear notch. So as a whole, this is the trochlear surface or trochlear notch. Now about the olecranon fossa, olecranon process. We get superior surface, inferior surface, medial surface, and lateral surface. How we can identify the lateral surface and medial surface? In the lateral surface, there is a notch with which the head of the radius articulates, and it forms a joint which is called superior radioulnar joint or proximal radioulnar joint. So this notch is articulating with the head of the radius. So it is called radial notch. And this radial notch is laterally placed. This is medially placed bone and this is laterally placed bones. Okay. So on the lateral side and medial side, we can identify by the presence of this radial notch. Okay. So again, I like to describe this olecranon process. So olecranon process has superior surface, inferior surface, medial surface, and lateral surface. Okay. Now the superior surface, here we are getting an attachment of a very important muscle. We know triceps, we know the biceps. Triceps, actually it has got three heads of origin: long head, lateral head, medial head. All these head joins and ultimately we get a tendon. This is present on the posterior surface of this muscle is present in posterior, in relation to the posterior surface of the humerus, and ultimately it forms a tendon, and that tendon is inserted over the superior surface of the Olecranon process. And also we get a joint capsule at the margin. So at the margin we will get the joint capsule, then we will get a bursa, and then we will get the attachment of the triceps tendon of the triceps muscle. So this is about the superior surface. Inferior surface is from the part of the trochlear notch, which is been divided by, one is medial part, major medial part, and lesser lateral part. এই যে ল্যাটারাল আর মিডিয়াল আমরা চিনলাম, এই যে রেডিয়াল নচ দিয়ে, এটা ল্যাটারাল। হ্যাঁ, এই যে সব সময় এই যে এটা ল্যাটারাল, তার মানে এটা এইখানে, এটা এর সাথে মিলছে না নিশ্চয়ই। নিশ্চয়ই রেডিয়াস এখান থেকে বেরিয়ে এখানে আর্টিকুলেট করবে না, তোমার হাত থেকে খুলে গিয়ে এখানে নিশ্চয়ই আসবে না। আমাদের ল্যাটারাল এইভাবে চিনতে হবে। এটা যদি ল্যাটারাল বলি তাহলে আমাকে রেডিয়াসকে তাহলে এর বাইরে চলে যেতে হয়, যেটা সম্ভব নয়, তাহলে মিলছে না। কিন্তু এই হাতে যদি মিলাই, দেখো রেডিয়াস এর সাথে মিলে যাচ্ছে। হ্যাঁ ঠিক আছে, ঠিক আছে, তাই না? এই যে বাবু, আমরা প্রথমে ল্যাটারালটা এইটাকে দিকে চিনতে পারি। হ্যাঁ, এইটা দেখে, কারণ এই রেডিয়াস তো ল্যাটারাল পাব। হ্যাঁ, এটা মিডিয়াল সাইড, এটা ল্যাটারাল সাইড। এবার আমি Olecranon নিয়ে বলছি। নাও, so this is superior surface and inferior surface. Now there is a posterior surface, and in the posterior surface you can see, and the posterior surface is subcutaneous, you can feel, and there is a triangular area, triangular subcutaneous area. এই হাতে পাও, দেখো যে ট্রায়াঙ্গুলার, দেখো ট্রায়াঙ্গুলার সাবকিউটেনিয়াস এরিয়া। তুমি পেছনে যাচ্ছ কেন? ব্যাক বেঞ্চে করছো কেন? এসো, একটু সামনে এসো, ভয় কিসের? এই দেখো, the posterior surface is triangular. দেখো দেখো, হাত দিয়ে দেখো, হাত দিয়ে ফিল করো। You can feel it with your own finger, and you can see this is a triangular area. From here one border actually starts. Okay, I will tell you what okay, first superior surface, inferior surface, and this is the subcutaneous posterior surface. And here we will get so many bursa, and also there are some lymph nodes which are in relation. Okay, subcutaneous, you can feel the subcutaneous area. This is that area. দেখেছো? This is the subcutaneous triangular area. এই দেখো, this is the apex, is the base, this is the apex triangle. এই দেখো, you have to মানে this is the subcutaneous area, and this is the triangular subcutaneous area. From here one border starts. Okay, I will describe it. The border. Now it has got medial surface and it has got lateral surface. In the lateral surface we can get a crest. In the lateral part we are getting one crest, which is called supinator crest. দেখো এই যে এটা, you can feel it, you have to feel with your finger, supinator crest. এই যে on the lateral surface you can see the supinator crest. পেয়েছো? বোনস কেন? বাপ, বোনস জোগাড় করো। যা হোক করো জোগাড় করো, কিনতেও পারো না কিনতে পারো, যা ইচ্ছে করো, কিন্তু জোগাড় করো, আদারওয়াইজ কিনতে পারবে না। সে আসল বোন হোক নকল বোন হোক, যা হোক একটা কিছু হাতে রাখো, বিকজ ইফ ইউ ডোন্ট হ্যাভ এনি বোনস you will not have any impression, visual impression. Okay, you cannot memorize. This is the supinator crest. এই ঠিক আছে। supinator crest এই যে বাবু, এই এটা দেখছো, এই যে ল্যাটারাল এখান থেকে এই এত বড় supine, because that muscle, that is supinator muscle, takes its origin from here. It has got humeral origin and as well as ulnar origin. Okay, so this is the supinator crest. কোথায় যাচ্ছি, ল্যাটারালটা আগে খোঁজো। এই এত সুন্দর, তোমার বংশীতে আরো সুন্দর আছে supinator crest. Crest, what is crest? Elevated, bony elevated line. Bony elevated line in a, or it's a elevated line in a bone. এই এত বড় নচ, ওকে যাও বাদ দাও, রিচ। So we can see, so this is medial side, this is the lateral side, and we can see the supinator crest. Actually it is on the, it is related to the coronoid process. It's continued above. Okay, now about the coronoid process, it has got superior surface or trochlear surface. This is the anterior surface, superior surface, inferior surface, and this is the anterior surface. And in the anterior surface you can find a rough bony area, rough bony area, which is called tuberosity. Tuberosity we got in radius also, that is called radial tuberosity, and also we are getting ulnar tuberosity. Okay, is very prominent anteriorly placed, there is ulnar tuberosity. Okay, so this ulnar tuberosity is for insertion of one muscle. We know this is biceps. In the arm, in the anterior part of the arm or front of the arm, we get two flexor muscle. One is superficial flexor, that is the biceps, and below the biceps there is another muscle just below the biceps we can feel, that is the brachialis, which takes origin, brachialis, brachium means arm, so it is taking origin from the brachium or the arm, from the anteromedial and anterolateral surface of the humerus, the body of the humerus, that is called brachialis muscle. That brachialis muscle is ultimately becomes a tendon, muscle becomes tendon, and this tendon is attached here. So this will cause flexion. Remember, both the biceps muscle, brachialis muscle, and also coracobrachialis muscle, they are supplied by musculocutaneous nerve. Though lateral part of the brachialis muscle, this lateral part means this side, this is medial part. Lateral part of the brachialis muscle is also supplied by the radial nerve. This is another muscle which is being supplied by two nerves. Okay. Medial part by the musculocutaneous and lateral part by the radial nerve. Okay. So it's called hybrid muscle. There are so many hybrid muscles. Like in forearm, there is flexor digitorum profundus. Flexor digitorum profundus. I told you there are some superficial flexor, there are some deep flexor. So that deep flexor, which is called flexor digitorum profundus, that muscle is also supplied by two nerves. When a muscle is supplied by two different nerves, it is called a hybrid muscle. It is being supplied by both by the medial part by the ulnar nerve and lateral part by the branch of the median nerve, which is the anterior interosseous nerve. And also in the lower limb, piriformis muscle, which is also supplied by two nerves. Okay. By the femoral nerve and the obturator nerve, branch of the obturator nerve. Similarly, there is one muscle which is called adductor magnus, which is also supplied by two nerves. Okay. Obturator nerve and also by the there is another nerve that is actually this is a hamstring. The other, it has got two parts. One is hamstring muscle and is adductor muscle. So that is also supplied by tibial component of the sciatic nerve. So forget everything. If you cannot remember, just remember there are some hybrid muscles in the body. They are supplied by two different nerves. So just remember, in brachialis muscle is supplied by two nerves. One by the mid, it is supplied both by the radial nerve and musculocutaneous nerve. So this area is for the insertion of the brachialis muscle. Biceps muscle is definitely, it is causing flexion. And also remember, it also causes from pronation to supination. So it is also, it is a supinator. It is a supinating muscle. So it is called supinator longus. Strong supinator. This is pronation and this is supination. This is pronation, this is supination. Okay. Kings pronate. Remember, beggars supinate. So from pronation to supination, this is helped by not only by the supinator muscle but also by the biceps muscle, which is called the supinator longus. Very strong supinator. And also the medial surface, in the medial surface we can find a depression. In the medial surface of the coronoid process or upper end, we can get a depression. or deviation. Somehow it is deviated. This is because of the fact during pronation and supination there is this type of movement. Radial tuberosity actually moves like this. And this deviation is for accommodation of radial tuberosity during its movement. So ভালো করে বোঝো, এখানটা দেখো একটা ডেভিয়েশন দেখছো, ডিপ্রেশন মতো, it is been accommodated by this একটা গ্যাপ, একটা দেখতে পাচ্ছ, একটা ডেভিয়েশন দেখতে পাচ্ছ, এটা এখানে একটা হ্যাঁ হলো একটা জায়গা পাচ্ছ, কেন এর এই যে রেডিয়াল টিউবরসিটিটা মুভ করবে তো তার জন্য। So this area accommodates the radial tuberosity. এই যে দেখো এটা ডিপ্রেশন মতো পাচ্ছ, এই ডিপ্রেশন এটা হ্যাঁ ল্যাটারাল সারফেস, এই কোরোনয়েড প্রসেসের ল্যাটারাল সারফেসের দিকে এই জায়গাটা এটা ডিপ্রেশন পাচ্ছ বাবু। ডিপ্রেশনটা হচ্ছে দিস ইজ ডিউ টু অ্যাকোমোডেট দিস রেডিয়াল টিউবরসিটি। এইটা during pronation and supination there is movement of the radius, okay, so which is been accommodated this rate. So during pronation and supination the radial tuberosity is been accommodated in this area. And is about the coronoid process, this is superior surface, inferior surface, anterior surface, medial surface, lateral surface, and this is the medial surface. In the medial surface we will get one muscle we will get in relation to it, that is flexor carpi ulnaris, and also a muscle which I have already told you the name, that is flexor digitorum profundus, which is taking mainly from the anterior surface of the, taking origin from the anterior surface of the ulna. Also it occupies the medial surface of the coronoid process. So flexor digitorum profundus, it has got a vast origin from here, from the medial surface, and also it encroaches the medial part of the coronoid process. Okay, name of the muscle flexor digitorum profundus. Profundus means deep. Flexor digitorum superficialis, that means it is superficial muscle. Flexor digitorum profundus means deep seated muscle. Okay, that flexor digitorum profundus, it has also an bony origin from the medial side of the coronoid process, and rest of the part is also related to flexor carpi ulnaris muscle. Okay, now about the anterior, now about the shaft or the body. Now the shaft of the body has got three borders. One is anterior border, one is posterior border, and one is medial or interosseous border. Why interosseous? Interosseous membrane actually gets attached to it, the interosseous border. Now from where I will trace from where I will trace it. This is the ulnar tuberosity. Just below the ulnar tuberosity. We can trace this border from the ulnar tuberosity and it will go down. And it will be continued up to the styloid process, anterior part of the styloid process. Okay, this is the anterior border. Interosseous border is very sharp. It is continued above as a supinator crest and it is continued below and it is continued up to the, this part is called the head of the ulna. So, up continuous to the medial part of the head of the ulna. Similarly, the posterior border starts from the apex of this triangle. This is the apex of the triangle. Okay. From here it will start, it will go down and it will go up to the posterior part of the radial styloid, ulnar styloid process. So, these are the three borders. One is anterior border, one is medial or interosseous border and one is sorry, আমার একটু ভুল হয় বলতে বলতে ঘর medial বলতে গেলাম. Sorry, this is absolutely right. Radius is that is the medial. Sorry, I am very sorry. Thank you for correction. This is the lateral side or the interosseous border. Okay, I am very sorry. What I was uttering in my mind, it's a lateral, but when I am speaking, it becomes medial. Sometimes right, left, right, left. So, thank you. So, it is continued above as supinator crest and from the supinator crest it goes down and goes up to the medial part of the head of the ulna. Anterior border, this is the posterior border. Posterior border I told you from the apex of the triangle, subcutaneous area, from here it is going down. So, we are getting, if we get three borders, we can get three surfaces. A তিনটে border পেলাম, anterior border, lateral border, posterior border. So, if I can hold it in anatomical position, then this becomes the anterior surface, this becomes the posterior surface and this becomes the lateral surface. In the anterior surface, we are getting anterior 3/4 of the surface is very important. Upper 3/4 of the anterior surface is for origin of flexure digitorum profundus. It is generally, it is for the flexion of the distal fingers. It is attached to the distal fingers. Whereas the superficial flexure, that is flexure digitorum superficial, is attached to the that is the middle phalanx. Okay. So, it will cause the flexion of the middle phalanx and proximal phalanx. The distal phalanx is flexed by this flexure digitorum profundus. During dissection, it will be apparent to you. So, upper 3/4. So this muscle not only takes origin from the anterior surface of the ulna, that is upper, not only from the upper 3/4 of the anterior surface, also it takes origin from the medial surface and it reaches the medial surface of the coronoid process. Vast origin, okay, and it also takes an origin from, there is a fascia that is the medial intermuscular septum is attached in the posterior border, medial intermuscular septum, one muscular septum like membrane like structure, from there also it takes origin, okay. And in the lower part we can see a linear ridge, এই যে feel করো, in lower part, lower 1/4 we can এই যে feel করো, linear ridge, এই যে linear ridge দেখেছো, হ্যাঁ ওই তো উঁচু আছে দেখছো না, এখানে তারপরে ডিপ্রেশন মতো মাসেল এরিয়া। তো এই দিস লিনিয়ার রিজ ইজ ফর দ্য origin of another muscle, quadrangular in shape, and it originates from ulna and inserted over the radius, quadrangular shaped muscle, and it helps in pronation. So name of the muscle should be pronator quadratus, taking origin from the ulna, inserted over the, taking origin from lower 1/4 of the ulna and inserted over the lower 1/4 of the radius, which has got superficial fibers and deep fibers. Only the superficial fibers are really causing the pronation, and deep fibers are the binders between the radius and ulna. Yesterday I have already mentioned that one, okay. মনে পড়ছে একটু কালকের কথাটা, that is called the superficial fibers are pronators and deep fibers are binders between these two bones. Pronator, the name of the muscle is pronator quadratus, okay. So this is the anterior surface, okay. Now anterior surface is bounded in between anterior border and the lateral border or interosseous border. In the interosseous border, what we get? The attachment of interosseous membrane. There is a gap in the upper part in between the oblique cord and the interosseous membrane, through which posterior interosseous vessel passes. Right? So this is the interosseous border. So this is anterior surface. Now we can come to the posterior surface. In the posterior surface we can find one oval area above. This is the posterior surface, and this posterior surface is bounded, this is posterior part, posterior border and interosseous border, okay. Posterior border and interosseous border. Posterior means ওইটা দাও, তাহলে ইমপ্রেশনটা তৈরি হবে। Like this is the posterior surface. I have shown you one diagram yesterday. Some muscles are taking origin from both from the radius and ulna, okay. Now this is the posterior surface. the upper oval area is for one muscle. We can find one upper oval area, and here we are getting a flat area. Upper oval area, it's oval area. Okay, and this is a flat area. ফ্ল্যাট ফ্ল্যাট এটা কেন ওভাল, এটা ইমপ্রেশনটা ঠিক মতো পড়েনি, সেই জন্য ওভালটা ভালো বনে দেখি ওই বনটা থাকতে পারে। এই দেখে পেয়েছো আপার ওভাল এরিয়াটা? একটু ভালো করে দেখে বলি। না এটাতেও ভালো নেই, তাও যে মোটামুটি আছে, খারাপ না। এটা তো আরো খারাপ আছে, এটা তো ভালো না। দেখি তোমারটা। এটাতে খানিকটা আছে, তাও এইটা দেখো এই ওভাল এরিয়া মতন, ঠিক আছে? আর এটা হচ্ছে ফ্ল্যাট এরিয়া। এই দেখো এটা ওভাল এরিয়া মতন একটা এরিয়া, আর তলাটা ফ্ল্যাট, ঠিক আছে? এই আপার এরিয়াটা আর নিচের ফ্ল্যাট এরিয়া। এই দেখো এই বনসাটাতে ভালো আছে, এটাতে আপার ওভাল এরিয়া মতো একটা আছে, এরকম একটা ওভাল শেপের এরিয়া, এটা মাসেল লাগবে এখানে। আর এইটা দেখো ফ্ল্যাট এরিয়া, এটা ফ্ল্যাট ফ্ল্যাট, ঠিক আছে? এই পস্টিরিয়র সারফেস উপরে একটা ওভাল এরিয়া মতন, ঠিক আছে? এই এই আর নিচে ফ্ল্যাট এরিয়া। এটা কার নাও, this upper oval area for insertion of one muscle which takes origin, এটা ভুলে যাও কোন সাইড, এটা অ্যাকচুয়ালি হিউমারাস কারোর আছে, দেখি তো এটা কার, দেখি হিউমারাসটা দিয়ে দাও। রাইট রাইট, আর দাঁড়া এখানে যদি বোঝাতে পারি। This is the lateral side. One muscle is taking origin from the just above near the lateral epicondyle, on the posterior part of the lateral epicondyle, and it is inserted, the triangular muscle, it is inserted over this area. This muscle is also which causes the extension of the elbow, not only the triceps, but also this is another muscle, triangular muscle, okay, taking origin from the lateral, the posterior part of the lateral epicondyle and inserted over this oval area on the posterior surface of the ulna, and this muscle is called anconeus muscle. Name of the muscle is anconeus, which is also causing extension of the elbow. Not only triceps, also there is small muscle which is taking origin from the lateral epicondyle and it is inserted over this area. This is the anconeus muscle. Both triceps and anconeus muscle, they are supplied by radial nerve. It is a posterior compartment of, it is present in the posterior compartment of the arm. So posterior compartment of the arm is supplied by the radial nerve, branches of radial nerve. Okay. This is basically a fixator muscle. It fixes this elbow joint. So this is for the anconeus muscle. And here in the lower flat area, the lower flat area is being divided by one bony ridge. এই দেখো bony ridge, দেখো এই যে bony ridge, ঠিক আছে, এই যে দেখো one bony ridge, হাত দিয়ে দেখো ফিল করতে হবে, দেখো এই লোয়ার ফ্ল্যাটটা দেখো এটা বনি রিজ দিয়ে ভাগ করা আছে, মানে এটা হচ্ছে এই দেখতে পেয়েছো তো, রেডিয়াসটা দাও, রেডিয়াসটা লাগালাম, রেডিয়াস ল্যাটারালি থাকে, এটা ল্যাটারাল, রেডিয়াস ল্যাটারাল, এটা পস্টেরিয়র সারফেস, এটা ল্যাটারাল, তাহলে দিস ইজ ল্যাটারাল পার্ট and this is medial part. এই যে bony ridge. Okay, the posterior surface is divided by this bony ridge. এটা একটা bony ridge. এটা তো অবশ্যই muscle impression. Bony ridge. See, bony ridge divides the posterior surface into lateral part and medial part. Medial part is smooth, but the lateral part is rough and there is a depression. Definitely there is attachment of the muscle. This bony ridge is dividing this surface into lateral part, medial part. Medial part is smooth, but this lateral part is rough and there is depression. That means there is attachment. We know there are some muscle which takes origin from this part. এটা anterior, এটা posterior. এই দেখো এখানে বনি রিজটা আছে, ফিল করো এই দেখো, এই দেখো এখানে তিনটে মাসেল এঁকেও ফেলেছে, এই যে ল্যাটারাল পার্টে একটা দুটো তিনটে মাসেল, এদের নাম আমি বলবো। এদিকে তাকাও, বই থেকে এটাকে দিকে তাকাও, বই থেকে এটা তো প্র্যাকটিক্যাল দেখতে পাচ্ছ, হ্যাঁ বই তো সারাদিন পড়ে থাকবে, তাও কালকে পড়াশোনা করো, এখন বই খুলছে, বাড়ি গিয়ে বই খোলেনি কালকে। এই দেখো কিছু মনে করলে না তো, ভালোবাসি বলে তুমি সন্তান সম। আচ্ছা এইটা দেখো, দিস ইজ বনি রিজ, ঠিক আছে, এই বনি রিজটা দেখো, দেখো এটা ল্যাটারাল সাইড, এই যে রেডিয়াস ল্যাটারালি থাকে তো, এটা ল্যাটারাল সাইডটা দেখো বেশ ডিপ্রেশন পাচ্ছি, বেশ রাফ এন্ড ডিপ্রেসড, তার মানে এখানে মাসেল টাসেল আছে। মিডিয়াল পার্টটা স্মুথ, এখানে কিচ্ছু নেই, এখানে কোনো মাসেল টাসেল কিচ্ছু থাকে না, শুধু একটা টেন্ডন থাকে, এখানে এক্সটেন্সর কার্পাই আলনারিসের একটা জাস্ট রিলেশন থাকে। and this medial part is actually related to some muscles, বুঝেছো হ্যাঁ, আমি ধরে ধরে বুঝাবার চেষ্টা করছি। তো the same picture কালকে যেটা এঁকেছিলাম, this is radius, this is ulna. So divided into upper oval area, this is for anconeus, Okay, this is lateral side, this is medial side. Okay, and here we are getting interosseous membrane. This is the head of the ulna. This is the styloid process. This is the styloid process. বলছি 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 সব। Radius, this is the posterior aspect of the radius and ulna. Okay, and this is the oval impression, and here we are getting one bony ridge, linear ridge. Okay, from here we are getting origin of one muscle, which is also taking origin from here also. Okay, and ultimately it goes down, which is, yesterday I told you, abductor pollicis longus. Abductor pollicis longus. Another muscle is taking origin from here, which is also going hand in hand with abductor pollicis longus, causes extension of the thumb. So extensor pollicis brevis, short muscle. From here one muscle, and from here another muscle. This muscle passes behind the dorsal surface of the lower end of the radius. Extensor pollicis longus. And this muscle also through the dorsal part of the lower end of the radius, that is extensor indicis. Flexion, extension of the index finger. So this is extensor indicis. So this lateral surface or lateral to this bony ridge, we are getting attachment of three muscles. Above, abductor pollicis longus. In the middle, extensor pollicis longus, and from the lower part, extensor indicis. So though this area appears very small, but from above below we are getting abductor pollicis longus, extensor pollicis longus, and extensor indicis. There are three muscles are at. The medial part is very smooth. Medial part, we are getting in the medial part, we are getting one tendon is related to this medial part, that is the extensor carpi ulnaris. Extensor carpi means carpal bones, extension of the carpi bones placed on the radial ulnar side, extensor carpi ulnaris. So that tendon is present over here. Okay, on the smooth part, but it is not attached, it is just related. But these three muscles are attached to this bone. So this part is, that's why this part is smooth. Any depression, any roughness is caused by muscle. Right? In the lower part, we are getting lower end, one styloid process. Stylus means pointer. This is a styloid process. What is the difference between the styloid process of the radius and ulna? Bolo? Radial styloid process is around 1 to 1.25 centimeter below the styloid process of the ulna. So here this is adduction is, the angle of adduction is more, whereas this styloid process of radius will prevent the abduction. So angle of abduction is less, because this causes an hindrance. But here the angulation is more, angle of adduction. Because this radial ulnar styloid process. Now this ulnar styloid process is directed posteromedially. You can see posteromedially. Okay, posteromedially. And this is the head of the ulna, and this is the styloid process, and in between there is a depression. देखो, এটা head, এটা depression, and one triangular articular disc, triangular means triangle shaped articular disc is attached over this area. From here, the base is here, base is here, apex is here. So this becomes a triangular articular disc is attached. এখানে বেসটা এখানে থাকবে, এই articular disc. What is disc? Articular disc? It is a cartilage. Cartilage. It is a fibrocartilage disc. So it is attached here. The base is here and the apex is here. So it forms a triangular articular disc. So it is covered. It covers the head of the radius, and it prevents ulna to take part in wrist joint. If there is articular disc, so that will prevent. So remember, this ulna is not taking part in wrist joint formation. Clear? Which is prevented by the articular disc. There is a one articular disc which is present here. So it prevents the ulna to take part in the joint formation. Only this scaphoid and lunate can take part, but this has been prevented by the articular disc which separates the wrist joint and the ulna. Okay. What is ossification? Process of bone formation. We know the primary center of ossification and secondary centers. Primary center for the major part of the bone or the diaphysis, and secondary centers for the epiphysis. The center which appears first, joints in case of epiphyseal centers, the centers which appears first unite last, which the center which appears last unites with the shaft first. Right? And another law, in case of male or in case of female, the ossification is 2 years earlier than the male. They are much more advanced. Females are much more advanced. Ossification is already complete. They are more matured than the male of same age. Because 2 years before, the ossification is complete in case of female. That is another law. So, in a young long bone or young long bone like ulna, the primary center appears in intrauterine life. Generally, another law, the primary center appears before birth, generally, except the carpal bones. Primary centers can appear after birth. And the secondary centers appears after birth, generally. But in the lower end of the femur, the secondary center appears just before birth, at 9 months. So, the primary center here appears at the age of 8 weeks intrauterine life, 8 সপ্তাহ. Secondary centers for the upper end, it appears after birth and it appears at 8 years generally and joins with the shaft at 16 years. 8 বছরের appearance, 16 বছরে it joins with the shaft. In the lower end, it appears 6 years. So, it is earlier. 8 বছর, এটা 6 বছর. It is earlier. এই তো হয়ে এসছে 3:30 হোক না, টুর্নামেন্ট থেকে যাবে, কিন্তু এইটা আর থাকবে না। বলবে সৃজিত স্যার বলেছে, সৃজিত স্যার একটু আটকে রেখেছিল, দুষ্টু স্যার আটকে রেখেছিল, বলে দিও। And the lower center appears at around 6 years. Okay, and it joins with the shaft at 20 years. Okay, আগে হলে পরে জয়েন করবে। এখানে 6 years, 18 years, 8 years, 16 years এ, আর এটা 8 years, এটা 18 to 20 years এ জয়েন করবে। ঠিক আছে, এটা 8 year, আপার এন্ড হচ্ছে 8 years এ অ্যাপিয়ারেন্স, জয়েন্স উইথ 16 years, লোয়ার এন্ডে 6 years আর জয়েন্স উইথ 18 to 20 years। ঠিক আছে, 8 বছর, 16 বছর, 6 বছর, 18 বছর অথবা 20 বছর। ঠিক আছে, আরেকটা জিনিস বলে দিই, দ্যাট ইজ দ্য night stick fracture. Okay, actually it happens in the guards. What is fracture? What is fracture? Fracture কাহাকে বলে? When a bone is broken, there is a discontinuity or broken within the shaft or any part, that is called the fracture. Fracture with displacement, without displacement. And there is a very common fracture which is called the night stick fracture. It happens in the night guards. So, suppose some person is coming, he wants to resist. Okay, he is coming with some sticks, some person is coming with sticks and he tries to save his hand, save himself or herself with the upper extremity or with the forearm. So there is direct fracture over this bone, and it is called knife stick fracture. Knife stick fracture.